Welcome, welcome to the Empowered Team podcast. I have a brand new guest today, and this is so exciting for the men out there, especially, but women, ladies, you're going to be loving this too as well. So, I have expert Dr. Keith Nichols, and Keith Nichols is a medical director and CEO of Tier 1 Health and Wellness. It's a medicine clinic headquartered in Chattanooga, Tennessee, and he and his wife Angie have founded this wellness center, and it's dedicated to promoting optimal mental, physical, and sexual health through the aging process. So, from what I've gathered from Dr. Nichols is really that he's very, very proactive. This is about us living our best lives. And when I say us, I mean people, because we're talking about men today. We're talking about men's hormonal replacement today. So he's also an author and a speaker and has become one of the most recognized, foremost experts in testosterone replacement therapy. But specifically, Keith has become known for a specific testosterone cream with specific application that wasn't popularized before, wasn't used before. This is something that he's not only done the research and explored the research, but also takes a look at what the results are and what really, really works for people. So the other thing I'd like to point to is just how important this is now. In our day and age, we're learning more and more. We're learning more and more what's coming into our systems, what's overloading our systems, what our hormonal needs are. And sometimes as men, I'm not a man, but the men that I serve and the women that are out there, we just don't know what we're supposed to do. We don't understand what is happening with our bodies as we age. And the men that I work with are high performers. These are people who love to perform mentally and physically. And when it comes to aging, they're probably not ready to slow down anytime soon. So, welcome, Dr. Keith Nichols. Thank you for being here. And I just want to lead you in that way and say, bring us, take us to the water we'll drink. So
Well, thank you,
tell us
Kari.
more.
Thank you, Kari, for having me on. It's my pleasure. My pleasure. Look forward to doing it, and I admire everything that you do out there. I really appreciate what you do for men and women all over this country. So thank you very much. It's, once again, my pleasure.
Thank you so much. Well, I went a little, I'm a bit of a keener and I want to serve my clients. So I went to a few of my clients and I asked the question, I'm going to have an expert in hormone replacement therapy for men. What do you want to know? And they sent me a few things. And one of the first questions was, what do you recommend to balance and optimize testosterone? Because some of the men over 40 are noticing they might have less energy. They might have less arousal. They might have less less of the tendency to hold muscle mass than they used to. So there's a number of things that they might point out. So if we start off with kind of a really broad general question, what do you recommend when it comes to testosterone and balancing, or is it balancing? What do you do? Do you customize? Start us off.
Well, Kari,
Educate the ignorant here.
Kari, you're 100% correct, and it's all about prevention. All right. Unfortunately, as we age, our hormones decline, and with that decline, so goes our health. They're tied intimately together. So what we really do in men 40 and above, women too, is we optimize their hormones. We'll talk about testosterone today in men because as we age, it does decline. It declines in everyone. So what we're trying to do is maintain the health span, that
Mhm.
period of our life where we're independent. We're trying to prevent age-related disease, disability, dependence, and more specifically, frailty. Now,
Mhm.
there is what I consider the trifecta of health, the foundation of health, and it's three things, and it's always going to be these three. You're never going to get away from it. You can't escape it. Number one, it's adequate nutrition. I don't really like the word diet, but nutrition. All right. Number two, it's of course exercise. So those are fundamentals that we need to have in our life for daily for the rest of our lives. But then after age 40, some may be younger when they develop symptoms of deficiency, but definitely after age 40, It becomes about nutrition, exercise, and hormone optimization. So the best way to optimize hormones, of course, testosterone, is you're going to literally take testosterone. That's how you optimize levels of testosterone. So those men out there after age 40, yes, you're seeing that decline that you're talking about, the reduced sexual desire, the low libido, the decrease in the frequency of the morning erections, the erectile dysfunction, fatigue, and a lot of people with physical exhaustion, the irritability, the depression, the decrease in lean muscle mass, the increase in body fat, especially the visceral body fat, which is the dangerous body fat, which predisposes us, of course, to insulin resistance, diabetes, heart disease. So testosterone, healthy testosterone levels in middle age and older men provides us with all the same benefits that we had when we were younger. That's what hormone optimization is. It's maintaining healthy, robust levels of testosterone, for instance, as we age so that we get the same benefits that we had when we were younger. Testosterone works in everyone, male, female, young, or old. It works the same. When you take testosterone, and you tell me what other medication or drug out there in this world does what testosterone, for instance, does. It should be first line treatment in the aging process, especially for those with diabetes and insulin resistance and obesity. But it increases lean muscle mass, strength, endurance, exercise tolerance, bone mineral density. It decreases recovery time. It increases energy and motivation, self confidence, and initiative. It improves libido and sexual function. It improves cholesterol. It improves memory and cognition, decreases body fat, both visceral and subcutaneous, prevents Alzheimer's disease, decreases fatigue. It prevents and reverses insulin resistance and diabetes. It protects against prostate cancer, protects against cardiovascular disease, and the list goes on. Better the levels, the better those benefits. It's a dose response relationship with testosterone. So if you have healthy levels of testosterone, then you'll get all of those benefits from the testosterone itself. The problem that I see is men just don't get enough testosterone to maximize those benefits.
So when there's so many things that you've pointed to here that I'm just, eating up. And one of the first ones was the fact that you're not going to ignore that nutrition and exercise need to be in there. And then so that people don't grab onto the idea that, oh, testosterone's my solution. It's nutrition, it's exercise, it's living a life that's got this whole picture, and it's hormone optimization. So then you dive into this hormone optimization, and the list that you just gave, honestly, I think people's minds will be blown because they're not going to fully understand how much it contributes, how much our hormones contribute to such a vast, a broad spectrum of health, preventative, performance related, all of the things. And I'm talking thinking and feeling and energy and all of that. Never mind the other things you're pointing to, like managing cholesterol levels or just having decent cholesterol or preventing prostate issues.
Correct.
So this is really profound because I don't think that people fully grasp the spectrum. I think they think, oftentimes what I hear is that they think, oh, well, is this what getting old is like? Maybe my testosterone levels are down and maybe I need to do something about that. So if this is the case, now what I'm hearing, because if you think back in the day, some of the people that I knew 3 decades ago who were taking something like testosterone, they were doing it for anabolic reasons and trying to be a bodybuilder. You're talking about a much different scenario than that. You're talking about in my words, you can correct me here. You're talking about providing an amount that has been missing based on the aging process.
Right.
And you're topping this back up to what would be within normal ranges or optimal ranges for someone's ideal gender and age. Is that, I mean, I'm putting
That
my
that's
words
that's
to
an
it.
excellent question, and you've opened up a very good can of worms that deserve, deserves to be talked about more often. I've tried to bring it up. one of the ones that does bring it up, and you'll see a few things that I'm kind of known for. And let's talk about what you just mentioned, a few things. Number one, yes, testosterone will reward effort, but you have to put in the exercise, you have to have the adequate nutrition, but all three of those working together. There was a doctor by the name of Dr. Jeffrey Life back in the day, and he was quick to point out that he didn't look like he did in his 70s, and he looked very good for his 70s. He would tell you, I don't look like I do because I eat right and exercise every day. And I don't look like I do because I take hormones. I look like I do because I do all three.
Mm-hmm.
Without, if you take away one or the other, I will not look like I do. I will not be as healthy as I am. So it does require all three for maximum health, middle age and on. There's no doubt about it. Now, when it comes to levels, yes, once again, there is a dose response relationship with testosterone. Now, Kari, I can provide you with literally dozens of studies that shows that testosterone just doesn't work in men. You can give men testosterone and it doesn't work. That's why family doctors and internists will use those studies to argue against utilizing testosterone in men. And there is one common denominator in every single one of those studies. They only gave testosterone to raise levels a little bit. If you raise levels a little bit, you either get no benefit or minimal benefit. And that's what happened in those studies. But when you look at the studies where they gave an adequate amount of testosterone, the men benefited in every way that you can, you think that with increase in lean muscle mass, decrease in body fat, improvement in lipids, all parameters of health improve with adequate levels of testosterone. Now, the can of worms that you're open is this. You mentioned the physiologic range. Unfortunately, men are producing less testosterone than ever. The new normal range is much lower than it was 20 years ago, for instance, because the normal range comes from an average of a population, and the average of the population now is for men that are producing less testosterone than ever. So the normal range is 264 to 916 presently at LabCorp and dropping in some areas. That is not a healthy, normal range of testosterone, not at all. In the early 2000s, some labs, the normal range went up to 1,593. In June of 2017 is when the normal range changed. And prior to June of 2017, the normal range went up to 1,197. After June of 17, it dropped to 916 when a study came out by Dr. Travison, which provided us with these new normal ranges. So, for instance, if a man was being treated with testosterone by his family doctor and he had a level of 1100, let's say, back in 2017 in June, that was normal. He was patted on the back. Levels are good, Bill. You look good. Keep going. If you went back to that same doctor 3 months later, the normal range is now 916. So Bill comes in feeling great. All his parameters of health have improved, but his doctor looks at him now and says, Bill, your testosterone levels are way too high. It's dangerous because you're above 916. Well, nothing could be further from the truth. So it was healthy in June of 2017. Now it's unhealthy in October of 2017. It makes no sense because it shouldn't make sense. So there is no harm in testosterone, even in, let's use the word super physiologic level, a level above 916. What's most important that people need to understand is that whenever we treat, whenever the guidelines for treatment state to treat to the mid physiologic range, meaning the middle range between 264 and 916, there is no medical data to support aiming at a specific number in the mid physiologic range. None at all. That's just an opinion. Also, there is no medical data to support staying within the physiologic range while on testosterone therapy. In fact, I don't see many men improving from a clinical standpoint or women when you stay within the normal physiologic range. What we found from a clinical standpoint is when you get outside that physiologic range, so-called supraphysiologic, that's when you get the best, most robust clinical response. And no, we don't see any adverse effects with those levels. And there's a couple of reasons why we see this from a clinical standpoint. When we make testosterone ourselves, that's a very complex process. There's a lot of physiologic events that go into steroidogenesis. But when men are given testosterone, which is literally just the end product, we bypass all those physiologic processes and we just get testosterone. So, what we find from a clinical standpoint, if we could go back in time and if a man's testosterone level at 600, he was completely asymptomatic and felt great when he made it on his own. But as he aged, the level dropped. Now it's 300.
Mm-hmm.
If we now treat him with testosterone, what I find from a clinical standpoint, it typically takes double what it would have taken if he could have produced it himself. So when I give it to him, it's different than if he produced it himself. If he produced it himself, he would get asymptomatic and feel great at 600 in this specific man. But when I treat him with the end result, it typically takes a level double that. So around 1200, for instance. So there's no harm in a number outside of the normal physiologic range. And once again, think back on what I said earlier. The normal range went up to almost 1600 in some labs in the early 2000s. So it was healthy then, it was robust, it was good. Now all of a sudden it's considered dangerous, harmful, and abusive. And that's just not the truth. That's not the truth.
Okay, so this opens up a real curiosity that I have, and maybe this is too big of a big picture question, and it's that why are men's testosterone levels dropping?
Oh,
Why
that's
do you
easy.
think?
Oh, that's easy. That's
Okay,
easy. It's the environmental toxins that we're exposed
okay.
to. And that's an interesting question. I'm glad you asked it. At baseline, meaning someone that's not on testosterone, when I see men in my clinic, when I see a 60 and 70-year-old man come in that's not on testosterone, his levels are almost always higher than the 30-year-old men that come into my clinic. Why? Well, those 60 and 70-year-old men were not exposed to the environmental toxins, those plastics, those chemicals when they were younger.
Mhm.
There were no plastics then, right? They were not exposed to it. The younger men this day and age are exposed to it even in utero. Okay, from the
Yeah,
day they were conceived.
phthalates,
That's right.
microplastics.
That's
Yeah,
right. They're exposed to it from day one.
yeah.
And it's in the news all the time now. You can't really open up a paper or get online and read, any national news without this coming up in the microplastics, even found in, men's testicles, which they're showing that occurs now. And so that this, sperm has dropped 50% in
Yep.
men, and they're intimately, entwined, testosterone and semen. They go together. You have to have high intratesticular testosterone levels in order to achieve spermatogenesis. So that they are intimately intertwined. But it's the environmental toxins that are wreaking havoc on both men and women's endocrine
Mhm.
systems. And so we don't need less testosterone than ever. We're just producing less
Yeah.
testosterone than ever. We need more than ever. And it's something that I've been talking about for several years now, is those EDCs compete for the androgen receptor. So the
Mhm.
only way that we can treat these right now, because we can't limit the exposure, you cannot stop the exposure because they're ubiquitous. You can't get away from it. But what we can do is give the closest thing to an antidote that we've got, and that is testosterone. So you literally are trying to outcompete these EDCs for the androgen receptors. And that's part of, the thinking process that goes into a clinic like mine when we're treating these men. And what's most important for men to understand, and specifically your clients, is you can have completely normal testosterone levels, 3, 4, 500, and have significant symptoms of a testosterone deficiency. Having a normal level does not mean you do not have symptoms of a deficiency. That is not how hormones work. Each man has his own normal level. And we know that from studies where men were given pellets that dissolve very slowly, and they compared men. And as those pellets started dissolving, these men would fill out their symptom questionnaires, and they found that for each man, he became symptomatic at a very specific level. But what they also found out, that there was a lot of inter-individual variability, meaning that each man had his own number. One man
Mhm.
may become symptomatic if his level got below 400. Another might not be until his levels got below 300.
Mhm.
So having a normal level, there's nothing more common than the question, Here's my
What,
testosterone levels. Do I
yeah,
do I do I
am I
need to
normal?
do I need testosterone? I'm in the normal
Yeah.
range. Well, based on the guidelines, if you're above 264, mainstream medicine is going to tell you you didn't need it. Well, that happened to me too. The reason I do what I do is because of what I personally went through. My levels back then were 254. Normal was 250 at the lab that the doctor went to. So you're normal, Keith. Your levels are completely normal. You don't need testosterone. So went through $1 million workup, thinking I had cancer, whatever else. I was mistreated, misdiagnosed, and mismanaged by my own colleagues. It's not their fault. They didn't know any better, but that's just what occurred. So once I was able to figure it out on my own and get it corrected, it literally changed my life, or what I used to say, it gave me my life back. And that's when I decided, you know what? If it can happen to me, it can happen to anyone. And that's why I do what I do today, because of what I went through. And so a normal level man out there does not mean you do not need testosterone. Nothing, that could not be more untrue.
And this is across so many other areas that are health-based and preventative as well when it comes to hormones, because or even something as simple as vitamin D. I remember back decades ago working in high performance sport,
Mhm.
and our national level athletes were being tested for vitamin D, and they were being compared to what was normal. And these athletes needed not only a higher level of vitamin D in their systems, but they're being compared to the regular population. And there was no distinction between their personal needs as a high performance athlete or their individual needs as an individual versus what the standard for normal or the range is out there. And then you've got the conundrum of going from country to lab that have different sets of
Right.
ranges. So you're not even comparing apples to apples. You're
Correct.
comparing some other berry to some other citrus fruit because
That's
it's
right.
so for the consumer. I love that you're explaining this so concisely because it's clear as mud. It's just how would they know? And especially for the physician who may not know either because their specialty is not in endocrinology, it's in general practitioner or whatever, then they don't know that if they're telling someone that it's in normal, that may not be that person's normal. So we really are putting this is education for the consumer so we can advocate for ourselves to be able to then go, okay, ask some educated questions. What might I need? What might I not need? So I have some more questions for you. And some of these revolve around you're speaking of levels that basically someone has to figure out what is their normal. I'm gathering from what you're saying that they're figuring out by checking their symptoms.
Correct. We treat for
Fig-
symptomatic improvement, not aiming to a specific number. That is correct. That is
okay.
absolutely correct.
And then trial and error. You're going to start with a small dose,
Right.
get you up to blank, whatever that next level is, and then recheck the symptoms and so on. Is that kind of the step by step?
Absolutely, absolutely correct. Spot on.
Okay.
That's exactly
And
what.
then is that a, and is that a, this is an exogenous hormone, meaning it's not made in their body. It has to be brought from an outside source. Now, this outside source is likely a synthetic hormone, correct?
Well, what we use is a bioidentical form of
Okay.
testosterone. Now, the injections are not bioidentical, so they have an ester attached. But the cream, for instance, that I utilize is pure micronized testosterone. It's bioidentical. The chemical structure is identical to what men make on their own. The body doesn't know the difference. So,
Tell tell me why so many men have responded so well to the cream and why you like it so much.
well, it's just its ease of use. Men do respond to injections as well, but the cream is just so easy to use. So, it's when I provide men testosterone, I'll provide it two ways. There are other ways to get it. I just don't
Mhm.
find them as efficacious. We could talk about those
Mhm.
if we need, but injections and cream are the two most efficacious ways to provide testosterone to men. And I'll let a man decide how he would like to obtain his testosterone, whether it be via injection or via cream.
Mhm.
But I find that a daily utilization of either injections or cream works the best. The truth is, most men are just not going to want to inject daily for the rest of their lives, but it's
Mhm.
easy to apply the cream daily for the rest of your life. It's literally less than 11 seconds to apply that cream. I mean, I literally timed it. And the differences between the two are very, very easy to explain. Number one, yes, it's easier to take 11 seconds and apply a cream and not worry about needles, syringes, and vials. It's also going to be easier to travel with a cream than it is injections. Once again, traveling with needles, syringes, and vials. The
Hmm.
cream will not have a negative effect on a man's good cholesterol, the HDL cholesterol. The injections can have a little negative effect on some men's HDL cholesterol. All right. The cream also raises free testosterone levels better than the injections for any given total. So if you have a total of 1,200 in the same man on injections or cream, well, the cream's going to raise free testosterone levels better. And it's the free testosterone that exerts the benefits of testosterone at the cellular level, not total testosterone, but free testosterone. So those are really the benefits. And you do find that many men, due to that increase in free testosterone over injections, and it's a consistent free testosterone because the cream typically is applied twice per day. So there's no significant peak or trough. Okay. So there's no,
Yeah.
men will say out there, the slang peaks or valleys. There's no peaks or valleys. So there's no peaks or troughs. And, but with injections, since most men are not going to do daily, then there's going to have, sometimes they can have significant peaks and troughs.
Be- because they just haven't been as consistent.
Well, yeah, just because they don't want to inject daily, it's just going to be a problem. So they'll inject once or twice a week. But look, whenever you make testosterone yourself, whenever men make testosterone, the Leydig cells and do not in your testicles, the Leydig cells, they don't store testosterone. It's a constant release of testosterone. Now there may be a diurnal variation, but it's still a constant release. And so with the cream, there's a constantly good level of minimal peak or trough.
So this brings me to two other things. One is that if listeners aren't getting it, I'm going to be a little bit graphic here. When there's a cream, the guy is applying it to their scrotal area, and that's what's going on every day, everybody.
Right.
And away we go. Same for a woman if they were applying a
It's perivaginal.
estriol, yeah,
The
for
testosterone for women is applied perivaginally. That's right.
there we go, applying a cream in that zone. So, and then that brings me to the next question, which now am I forgetting it because I was so visually impaired
It's
there?
okay. Well, men may
Uh,
want to ask why apply it there. I mean, why? And let me explain that. You can literally apply this cream anywhere that you have skin from head to toe. I've
mhm,
applied it on all body parts, measured levels. You can get good levels anywhere. But the reason we use the scrotal application for this cream is because number one, we will typically get our best levels of testosterone applying it to that site because it's thin skinned and
mhm,
highly vascular. So you can typically use the least amount of testosterone to get the best levels. And
yeah,
number two, it reduces our risk of transference, believe it or not. Transference is transferring to someone or something. Now you
because it's
have to have, yeah, you
on
have
your
to have
hands. Yeah.
skin to skin contact for transference to occur. So with a scrotal application, we should have literally completely eliminated any risk of transference to children or animals. So we're just talking about our sexual partners, and there's easy ways to avoid transference to them.
Time between
Yeah.
contact, hand washing, that kind of thing.
Well, yeah, specifically, yes, always wash your hands after you apply it. Okay. But yes, when it comes to the cream, a person can wait 5 hours or longer after they apply it to have sexual activity. Or number two, they could simply wait till after sexual activity to apply it. Or number
Mhm.
three, at any time after they apply it and they're going to have sexual activity that wasn't planned, they could simply go into the restroom, take a towel, soap, and water, just wash off the application site. And then number four, many people are very scheduled with regard to their intimacy. If it happens to be that
Mhm.
night or nights that it's always going to occur,
Yeah.
you don't have to apply it at all. You will not notice any difference in how you feel or function by not applying it that evening.
Excellent. Excellent. And that brings me to something else you mentioned earlier because so it sounds to me like if I'm picturing this scenario, whether it's my husband, clients, whoever's in this scenario, it sounds like there's probably a regular schedule of not only blood work and consults to make sure that they're on the right track, and then on top of that, if they stop taking the testosterone cream, then their levels are going to go back down. But are they going to go back down worse than they were before because their body isn't naturally making it as much because it's being provided externally? What is the so then does that make them more dependent, if you will, on on external testosterone for the rest of their lives? What does this all look like? Because I want to understand the bigger picture, but also understand drawbacks or anything that may
Well,
come up.
all great questions. Let's see if I can cover all of them, starting at the last part and going backwards. Once you start testosterone, of course, you're starting testosterone because you have symptoms of a deficiency. So you're already not producing enough. You should have already tried all other methods to raise levels on your own, diet, exercise, supplements, whatever. But that typically is not going to work sufficiently to raise levels significant enough to exert a clinical response. But nonetheless, so you've started because you weren't making enough already. So therefore, you're on testosterone. If you start testosterone, no matter what the method of delivery, you're going to suppress your own production. And when you stop that method of delivery, yes, your body is not, you're not applying it, or you're not getting that injection. So therefore, yes, your testosterone levels are going to go down significantly. And it takes around an average of about 3 months for your body to start producing back the testosterone level that it would have been producing had you not been on testosterone. The reason that we say it's lifelong is because you only get the benefits while you're on it. You can stop it at any time. Men and women all around this country stop their testosterone every day. They just go back to feeling how they did before they started. There's no so-called significant crash, and nobody's ever called me
Mhm.
because they're curled up in a fetal position in the corner. I mean,
Yeah, yeah,
some people view it as if it was it's tapering off of a narcotic of some sort and get
yeah,
it
yeah.
withdrawal symptoms. That just doesn't happen. You just go back to not feeling well. But yes, the cream, the reason that it works so well in mature, intelligent, middle-aged and older men is because they can be consistent with it.
Mhm.
The great thing about the cream is that it will raise levels on a dime. You can lower levels on a dime. It's just a matter of the application.
Adjusting the amounts.
But if you don't apply it for a day, yes, your levels are going to be very, very low. All right. But if you apply it consistently, then it's never going to be low. And I think men need to understand that missing a dose here and there is not going to change how you feel or function. For instance, when a man has really severe symptoms of a testosterone deficiency, he can get an injection or he can start applying cream, and he's not going to notice any significant improvement in those symptoms in a day. All
Mhm.
right. Same goes for if a man is on testosterone and he doesn't apply it one day or misses his injection, he's not going to get symptoms of a deficiency in a day. All right.
Mhm.
So a lot of misinformation out there on forums and social media. And you mentioned labs.
Mhm.
Well, that was a really good question. And let's talk about labs a little bit. The job for me, my job is to optimize men and women's testosterone to the best of my ability. We can do that. They have the hard job, the sweat equity. They have to put in the exercise. They have to, get the adequate nutrition. I have the easy job. So we can optimize those hormones. Now, when it comes to labs, certain clinics use labs as an income generator. And that's kind of a red flag a lot of times. They'll have you sign up at maybe a lower rate, but there's all the little hidden fees that get to people. So if you're seeing a clinic and they want to do labs every 3 months or so, because they want to see if you're continue to be optimal or whatever their reasoning may be. Those clinics are usually utilizing labs as an income generator, and people tend to love labs. They get kind of drawn into that. That sales pitch of, man, we just need to make sure you're optimal. We just want to see those levels, and I know you do too. Yeah, I do. Yeah, I do, doc. Well, yeah, it's just money, and it's unnecessarily spent money. If hormone therapy is done correctly, typically only need one two labs at most from the beginning to get people where they need to be, especially men, with regard to testosterone. And then after that, if they continue to do it as prescribed and are consistent with it, their levels are amazingly consistent from year to year to year. So I only need labs once a year. I'll get
Wow.
labs. So I do not use labs as an income generator. So there's no hidden fees there. I will get any labs that a man or woman wants. It's their money to spend. If they want to order a lab, we can order whatever lab they want. But as far as what I need, I only need them yearly. And that's really when you're been doing it for a long time and have a lot of experience, that's all you should need. It should be very simple for people, but it's
Mhm.
made more complicated because unfortunately people view it as if it's more complicated, it must be better. When it comes to
Mhm.
hormones, nothing could be further from the truth. It needs to be kept very, because it is a simple process. We're taking an individual, male or female, that has symptoms of a low level of a hormone, testosterone, let's say, and we're raising levels to overcome those symptoms of a deficiency. That's all it is. It's that
Mhm.
simple, and it should be
Mhm.
that simple. People will
Mhm.
fear hormones, but last year alone, over the counter medications like non-steroidal anti-inflammatory drugs, ibuprofen, Advil, even Tylenol,
Hospital visits.
they
Yeah.
killed tens of thousands of people. It
Yeah.
literally killed tens of thousands of people. And that's not even a joke. You
That
can check
yeah,
that.
the people
Killed
are quick to
10,000 people.
pop.
That's
They're
right.
quick to consume.
Right.
So, so
And
on
testosterone didn't kill anyone last year, but yet people fear testosterone.
so on that fear note, what is to be feared if something was overutilized, or someone wasn't the right candidate for what is the uncertainty, or what are any of the concerns that can come with testosterone um, supplementation or utilization?
Well, when I see a man that has low levels of testosterone and he's insulin resistant, or he's low, even if he has normal levels, lower normal levels, but he has all the symptoms of a deficiency, then I will literally tell that individual that, and I'll ask him the question. There is, one potential risk that you take with testosterone, and that, for your health. And he'll say, well, what is it, doc? What is it? So not doing it. Your greatest health risk is going to come from maintaining those low levels that you've got, because there's an increased morbidity and mortality across the board with your levels. So
Mhm.
low levels of testosterone are terrible for men. Okay. That
Mhm.
increases their, once again, morbidity and mortality across the board. Healthy, robust levels of testosterone have never harmed anyone. They only provide us with health benefits, just like they did when we were younger. It should be no different than when we were younger. They didn't cause harm then. They will not cause harm now. We don't see
Mhm.
harm from a clinical standpoint. There's not a single randomized control trial. Testosterone has been used for about 85 years. There's not a single randomized control trial prospective study that shows any harm, such as heart attacks, strokes, or blood clots in men on testosterone, but yet they fear it. It's the
Mhm.
men with low testosterone levels that have all the problems, not with the optimal levels.
So for when I'm thinking about some of the demographics of the people that I know who could be candidates if they're not already using testosterone, they're in lifestyles that are pretty demanding. Their levels of stress might be high. They might be trying to do all the things. Are there external factors that can impair the success of using testosterone? Are there some things that you find also support the success of using testosterone? So if somebody, you've already mentioned nutrition and exercise, but let's say they're still working on their nutrition, they're still exercising, but there's a board meeting or a problem in the company or a whatever that goes on, or a family issue, and their stress goes through the roof. Are there other factors like that that you see really confound the results, or what happens with that?
Well, Car, you ask such excellent questions. I mean, I have to really give you credit there. I mean, if everybody out there, none of this was pre-taped, or none
Yeah.
of we talk about none of this, but what excellent questions. I mean, just superb. All right, let's talk about that. Testosterone is not a panacea. Okay. Once again, we're taking an individual with symptoms of low testosterone and all the bad effects that causes, and raising their levels to overcome those symptoms of deficiency. That doesn't make us superhuman in any way,
Mhm.
shape, or form. Now, yes, a lot of people will say, well, Dr. Nichols, you missed several things that people have to have. You mentioned nutrition, exercise, and hormones, but yeah, sleep and stress
Mhm.
reduction. You're right. We do need sleep and we do need to reduce our stress, but we're not in control of that. We are not in control of that. Most of us are not in control of the amount of stress that we have or how much sleep we get in a lot of instances. If your wife gets sick, child gets sick,
Mhm.
you're not going to get much sleep, and it's going to impair your sleep. So, but we are in 100% control of what we eat, whether we exercise or not, and whether we take our hormones. So every year I'll have men and their hormone levels will be just beautiful. And we're eating right and exercising. And I'll get a phone call from a couple of these men, Doc, it doesn't work anymore. I feel worse than I did before I
Mm-hmm.
started.
Mm-hmm.
I'm like, well, okay, Bill. And so I used to really dive in right away, but I stopped doing that many years ago because I go ahead and get their labs because that's what they really want. All right. Just, these hormones can sometimes be viewed as going to be an easy button for them. So we'll get those labs and then we'll meet. And in every instance, there's not an instance this has not occurred.
Mm-hmm.
Now, these men were doing great. The last time we talked, levels are beautiful. Now, all of a sudden, it's just not working at all.
Mm-hmm.
And so I'll meet with Bill, and Bill, your levels are the same. In fact, Bill, your bit levels are better than they were the last time we talked, and you felt great.
Mm-hmm.
So, Bill, it's not hormones. They don't stop working. People stop working, but hormones don't. And so, Bill, what else is going on? And these are the answers that I've gotten for these men. Doc, I'm going through a divorce.
Mm-hmm.
Doc, my wife had an affair.
Mm-hmm.
Doc, I'm working two jobs and I'm just working myself to the bone. I'm not getting any rest at all. Doc, I lost my job. Doc,
Mm-hmm.
our child, unfortunately got on drugs and is rehab. And, Doc, my mother-in-law moved in. She has Alzheimer's. It's just wreaking havoc in the household. So there's always one thing that enters their lives, and it's significant stress. Stress is the great equalizer. It will make anybody feel bad no matter what their
Mm-hmm.
hormone levels are. So that was great that you brought up stress. Yep. That's you so when men, if you don't get enough sleep, if you have sleep apnea, if you're under a tremendous amount of stress, then you're not going to feel as well, no matter how great your hormones are.
Mm-hmm.
I think whenever people see doctors, and I don't think it's done enough on social media or wherever else, I spend as much time explaining what testosterone doesn't do as I do what it does do.
Mm-hmm.
Okay, it's not, once again, it's not a panacea. Men think that they're going to use these words so-called dialed in. You'll never hear me use that word, but they will. That to them means that they just never have a bad day. They always have a great libido. They always feel good. They always want to exercise. That's not what testosterone does. Not what it
Mm-hmm.
does at all. It once again takes away those symptoms of a deficiency and makes you a normal man that's subject to all the ups and downs of all of us other normal men. That's all that it does. So yes, it provides us with tremendous health benefits, but it doesn't make us impervious to life and life events. And people look at you, literally look at you. I don't have any stress, doc, none at all. Well,
Yeah.
there's no such person. I mean,
Yeah.
I used to say, look, the richest man in the world is stressed over losing his money. And then the poorest man in the world is stressed over his next meal. So, and there's all in between. But stress, people always they think stress has to be bad stress.
Yeah.
It does not. For instance, you preparing for a podcast or that's stressful. There's
Mm-hmm.
stress and you're getting ready for a wedding. Stressful. Just stress is stress. You have young kids, you're married, you got a house to take care of, you got a job to go to. You may not think about it, but it's stressful. And that can impact how we feel and function. So, yes, stress is the great equalizer. It's great that you brought it up. So, testosterone in general, the summary of all this, it doesn't make us feel great all the time. That's not what it
Yeah.
does.
Yeah.
That's not what it does.
I really appreciate that you said that, and especially in the context for men specifically, because men, I'm going to generalize, men are doers. There are there are conquests, there's things to achieve, and their health often gets put into that bucket of I'm achieving my health or I'm achieving my performance or I'm achieving. And I love that you, as a physician, have asked the question, well, what else is going on? Because we, people and men, when asked, they have the answer. And sometimes I think physicians are not taking the moment to go and say, well, what is there for you? What's really going on?
Mhm.
And then to be able to give the feedback of reasonable expectations, because if there's a bunch of band-aids being put on, no matter how wonderful the nutrition is or the exercise or the hormone replacement or the whatever, if there are these big life events or these other big elephants in the room that aren't being addressed, and it could be a major emotional thing or a major life catastrophe. Those aren't being addressed. It doesn't matter how much we do in all those other areas, and that I love that that message has been addressed there. If
Hormones will
there
not hormones will not overcome life. They will not. They provide us with health benefits, but they will not overcome life's hardships. They will not.
Exactly. And if there was a question that one of my clients asked, and it was what questions must I ask when I'm with a doctor exploring this? So for those out there, the men that are going to approach you, your clinic, or whatever they have access to, what should they be asking for themselves to really support themselves and advocate for their best next steps?
Well, sure. I think that, well, we've talked about a couple of those things, but first and foremost, you'd want to know their personal experience with the use of hormones themselves. Do they have any
Mhm.
personal experience with it? And number two, their training. Of course, well, what is their training? How long have they been doing it? And then you want to get into some of the clinic specific questions, hidden fees. We've already talked about labs. And one question, especially for men, is that do they use what's called an aromatase inhibitor or not? Do they block estradiol? If they do, then that's a clinic you should walk away from. All right. That's a whole nother topic for another day. But believe me,
Mhm.
we don't want to block the beneficial effects of testosterone. That's what happens when you use an aromatase inhibitor. And if a clinic is following evidence-based medicine, then they will never do that. And I think it's important that there's really I call them a T mill. There's a testosterone mill on every corner now. You can't open up any social media without a mail-in testosterone clinic. Don't fall prey to those clinics. If one way to know if you're dealing with a legitimately good clinic or not is if they have a physician listed on their website, for instance. If you go to a lot of these T mills, there's no physician listed. What they
Mhm.
typically do is they go hire some, we call them wounded provider that really they're just hired for their medical license,
Mhm.
and they will just write a prescription for anything. So you're not really getting any close supervision. But I think the most important aspect of any clinic is accessibility. Uh, how often can I talk to you? How
Mhm.
available are you to
Mhm.
answer my questions? And that's the key right there. Now, that's where we try to set our clinic apart. I answer every single question every day. I never leave my office with any unanswered questions, and I answer them on weekends as well. So they have complete access to me at all times. Now, every clinic doesn't have to be that way. I mean, that's just I'm OCD about that. But nonetheless, I think accessibility is very important, and of course the training. And it doesn't take long to figure out the good from the bad. 70% of the patients I see come from other clinics.
Mhm.
That's just
Mhm.
just the way it is.
And on a personal note, how old are you, if you don't mind me asking?
Mhm.
And
58.
58,
Yep.
amazing. And then how long have you been supplementing with testosterone? Because I'm imagining you are
Probably 15 years now. Mhm.
15 years. And then for you personally, has the dosage changed a lot, or do you
Not at
find
all.
that you've just been able to maintain
Yes,
and it's
ma'am.
been easy to
Yes,
maintain what
ma'am.
you've
Yes,
done?
ma'am. It should
Yeah.
be that easy. It should be
Okay.
that easy. Once again, you do things correctly, the hormones don't stop working. Uh,
Yeah.
once again, people will. They'll stop eating right. They'll stop exercising, and they'll literally stop their hormones and do it consistently. That's amazing. People always want to get into the latest and greatest fads, and that's what they really are. I always tell my patients that, look, do you know how difficult it is to maintain good nutrition, exercise consistently, and do your hormones for the next couple of decades? That is extremely difficult for most people, and most
Yeah.
can't do it and won't do it.
Yes.
I see people every week that have been doing great for years and they just get
Yeah.
complacent and it's just outright lazy. And they'll admit it. I just got lazy, got complacent. Now I don't feel good. My levels are not good. Well, of course, you've got to continue to put that work in there for it to continue to work. So, but people do want that easy button. They'll look at all these new, things out there like whether it be peptides or they just want to get involved
Mhm.
in so many, even which are research chemicals, most of them now. And what they're looking for is that easy button. There is no easy button. There is no easy button. And I tell people, look, there's a financial decision to be made too. If you got on another substance that cost, let's just say you got on a peptide, whatever, that costs $300 a month. Well, just like testosterone and the other hormones, it's only going to work while you're on it.
Mm-hmm.
Get off, you're going to lose the benefits. Same thing with testosterone.
Mm-hmm.
You get the benefits while you're on it. So you always have to ask, if I add anything to my foundation of health, am I willing to make that investment for the rest of my life? Because it's only going to work if you do. So I'm not into these quick. There's no quick fixes. There's no quick fix.
So one of the things I'm hearing, and we say often that it can be easy to do and easy not to do. Just as easy
Absolutely.
to do and just as easy not to do. So when we keep that in mind, then we're not kidding ourselves into trying to make it one way, but it's just as easy to do as it is to not do. And on that note, for an investment, what is a typical investment for someone looking to do hormone replacement therapy? Are they looking at a few $100s a month? Are they looking at $100 a month? What does it
Yes.
look like?
It depends on how they're set up. There are some that I couldn't afford. I mean, I'll just be
Mhm.
honest with you. There's some that just charge the exorbitant fees, and then you got your T males that are, once again, they're
Dime a dozen.
on the dime a dozen, so they're not going to be very much, but they're not going to be around very long. Number one, once again, you don't have a real physician. And look, a lot of the younger guys are using it for performance enhancement. They're fine with that. It's not about health for them. I mean, it's
Yeah.
about just testosterone and performance enhancement. But for 40 and older, middle age and older people, they literally want adequate medical care. But
Hmm.
the clinic price structures can be different for different clinics, but of course, but they can range anywhere from $100 a month to some clinics charge $500 a month. I'm amazed at what they're charging out there, and some even more than that with a yearly fee. There's also some of them have this tiered structure to them where for X dollars, for $2,000 you get so many visits and this, and for $4,000 you get, and then for $8,000 you'll get complete access to your doctor. Well, you should have complete access to your doctor for
No
2,000,
matter what.
no
Yeah.
matter what, no
Yeah.
matter what. So I don't believe in the tiered access either. It just, and you said it so brilliantly. It should be very simple to do. You know, the goal for what we do is to get their hormones very optimal, and then they don't have to worry about it anymore. If they
Hmm.
do it correctly, it's just something that it's just like putting on your deodorant every day. When
Hmm.
you're truly optimal and you really know that things are as good as they can be, then it doesn't cross your mind again. But so many men out there are stressing over their so-called protocol and trying to mix and match this and make it more complicated than it needs to be. Well, you're right. It's as simple as you want to make it, and this should be a very simple process. But clinics can be very expensive, or down to the T mills that are charging. I don't know what they're charging, maybe $89 a month, whatever. So.
Hmm. Well, I love that information, and I love just how clear you and your wife are with your objectives and your mission overall to provide this optimized health for people that otherwise people aren't aware of, or they don't know how to advocate for themselves. And this is just one way you're allowing people to learn the information so that they can make the decisions to empower themselves. And that's what matters to us. So I really, really appreciate how much you've shared. It's been so profound. Your knowledge, your expertise, your experience. This just opens the door for people to feel more confident in being able to make these decisions for themselves. So that's just amazing. And people can reach you on Instagram at Tier 1 HW. You are on YouTube as well, Tier 1 Health and Wellness. You're on Facebook, Tier 1 Health and Wellness. And we'll put these links into our show notes so people can find you and look you up and reach out to you, all of those things. What would you like to share with people in parting, in just giving them this last bit of information that you wish everyone could know that maybe we haven't shared already, or reemphasize something that we have shared?
Well, listen, it's really all about prevention. I was at a conference not that long ago with a cancer specialist up there talking, and he pointed out very correctly that cancer, when a person's developed cancer in the 60s and 70s, it didn't start developing last year, or even the year before that. It started decades before. 80% of age-related disease, for instance, is preventable. So the core of what hormone optimization is really about is about that prevention. It's not waiting until you get symptoms of a deficiency or a disease that you could have prevented before you start treating. So
Mhm.
really, in a perfect world, you could take everyone 40 and above and optimize their hormones because it provides us with tremendous health benefits and prevention against those age-related
Mhm.
related diseases. And that's the key, to focus on what it's going to do for you long term. A person that starts at age 40 versus a one that didn't, there's a tremendous difference between those that do. And you can look around and look at some 60 and 70-year olds. It's not hard to figure out which ones are on hormones and which ones aren't. That's
Mhm.
very easy if you just start taking a quick look. So the key about any good solid clinic is that they're going to teach you that it's about prevention. They will answer all your questions, they even provide you with medical literature if necessary. So key is prevention. Don't wait until you get sick. Don't wait.
I am so grateful that you've shared that message because it's something that I wish more physicians were taking that attitude of prevention instead of treating symptoms. Not treating disease, not prevention, but treating symptoms. So I so appreciate your approach. I think it's fantastic, and we will share this out to as many people as possible so that they can get in touch with you and understand a little bit more about how they can manage themselves from a proactive standpoint, a preventative standpoint, and living in their best lives, living the way that they want to feel. So thank you so much, Keith. It's been such
Thank
a
you, Kari.
pleasure. This has been it's been enlightening as well as fun and interesting because this is the stuff I love to learn about. And I look forward to connecting next time and finding out more about what you're doing.
Anytime. Looking forward to it again too. Thank you so much, Kari. Really appreciate you having me on.
Thank you.